everybody, Ziv Simon here. I'm the creator of Surgical Master, the surgical training for dentists. Welcome to this video, and in this one I wanted to talk to you a little bit about some tips on the extraction process, especially when it comes to planning an extraction. And I was so happy to see the response to the recent ebook, How to Extract the Money Tooth, and following the release a couple weeks ago, I've been getting so many emails from the Surgical Master community and questions and a lot of x-rays sent to me. And I wanted to share two cases sent to me by Dr. Jeff Rosenberg from Philadelphia, Pennsylvania. Jeff, thanks so much for sending me those x-rays, and great being in touch with you and talking about interesting cases that you're doing there. So keep up the great work. Jeff sent me two x-rays of two money teeth. And if you're not sure what's a money tooth, go and read the book. It'll explain everything in detail, including all the extraction protocols. We're basically referring to the lower first molar. And Jeff sent me two radiographs with two teeth that he's planning to extract. And I'm going to talk about both teeth in two videos and talk a little bit about the analysis of the periapical x-ray and how important it is. And that's basically the only image that I'm going to show. And I wanted to demonstrate how much information you can get from one radiograph and how useful it is in identifying all the challenges prior to the surgical extraction. And I want you all to try this in your practice and spend the time before you perform the procedure and to be really, really prepared. So I'm going to start with money tooth number 1. It's a lower first molar on the left-hand side, tooth number 19 or number 36. It's obviously non-restorable and has a hopeless prognosis, and the plan is to extract and replace it with an implant. So looking at the radiograph, I'd like you to evaluate what are the challenges that you're seeing in terms of extracting this tooth. Because if you're going to get in there without any preparation, you're in for a couple of surprises, and that can cause a lot of frustration, and also the treatment outcomes will be compromised. So I'd like to be prepared, and it's almost like a preparation for battle where you're going to fight an enemy, and you need to know more about the enemy, more than they know about you, and that will give you the upper hand and help you win the battle. So I call these challenges the extraction enemies. You can read about them in the book in great detail. And I'm going to talk about the extraction enemies as they relate here to Jeff's money tooth. So Jeff, thanks again for sending this to me. So let's go ahead and list the extraction enemies. The first thing that I see is that the tooth is endodontically treated. That makes the tooth much more brittle, and it's prone for fracture when you attempt the removal of these roots. And you can point out a few weak spots. The second challenge is that the tooth structure is compromised. First of all, coronally. There's no coronal tooth structure, so you cannot use any type of universal or even specialized forceps. And number 2, the root structure is compromised in certain strategic locations, and how great it is to predict where these roots are going to break before you even started the procedure. The third extraction enemy has to do with the shape of the roots. So I'd like you to look at each root individually and see the curvature. And you see the mesial root has a slight curvature, more straight on the distal root. And that will help you to decide on the mechanics of extractions and how to apply your levers and how to use your instruments and in which direction. So it's very, very important. Now, if you look at the distal root, the apical part is much larger than the middle and the coronal part. And it's basically a fish on a hook. So if you try just to remove this root and you don't identify that there's hypercementosis, you're into some trouble. So you have to make some strategic decisions on how to rescue the distal root, and you need to have a plan for that. The fourth challenge are the adjacent teeth. You need to see if the adjacent teeth have any type of restorations. And why is that important? Because when you're applying forces to extract a tooth, especially a challenging extraction like this one here, you can apply forces on the adjacent restoration that are potentially destructive and you may cause even a breakage of the tooth or the restoration. So ahead of time, before you start the procedure, identify weak spots on the adjacent teeth. Be much more careful, number one. Number two, you may want to discuss this with your patient ahead of time. It should be in the informed consent process. And take all the necessary precautions so the adjacent teeth and restorations don't get damaged. Last but not least is the challenge of root proximity. And that's when roots are close to one another. That's totally anatomical. And the challenge is in two ways. Number one, the room for your instruments is limited. And number two, because roots are very close to one another, there's a potential damage that can occur on the roots of the adjacent tooth. So root proximity can sometimes be an issue. Sometimes roots are actually touching one another, so you have to be extremely cautious. So these are the 5 challenges that I see in extracting this tooth. And you can tell how much information I can get from only one periapical radiograph. It's amazing to see that many times we're missing all the important details and just rushing to do the procedure, while we could have predicted all these challenges and could have prepared for them. So what is the next step? The next step is, based on these challenges, based on the extraction enemies, you can devise an extraction strategy that includes selective tooth splitting and selective bone reduction in strategic locations to allow you to overcome these challenges and extract this tooth successfully. So now what I'd like you to do is comment on this video. Let me know what are the extraction enemies that you're seeing in your practice. What are the challenges that you're facing extracting lower molars? Share this video with other doctors facing similar challenges. You can read about the extraction enemies and all the different extraction strategies in my free ebook called How to Extract the Money Tooth and Create a Great Implant Site, where I describe all the extraction protocols and all the things that are very useful when you're dealing with lower molar extraction. You can now download it for free at moneytoothbook.com. Check it out. In the next video, I'm going to talk about another case that Jeff sent me and show you how to identify more challenges and how to be more prepared for lower molar extraction. So I'll see you there.